Joining us now is Ballad Health Chief Infection Prevention Officer Jamie Swift. Jamie, first off, your reaction to those new numbers out today. What are you seeing?
And we continue to see a significant increase in new cases. And so our hospitalizations have certainly increased a little bit. Keeping an eye on those, we're hoping that maybe we won't see an equivalent surge in hospitalizations, but we are seeing a significant increase in cases. Our hospitalization rates remain high. It really is just a very tense time across all of healthcare right now.
Do you believe that is because of the Omicron variant, which we've heard repeatedly is far more contagious? Do you believe that that's what's leading this surge in cases?
Yes, we did get some lab work back that indicates that the majority of the specimens that we tested were in fact Omicron, of those that were being subtyped. So we do believe Omicron is probably the leading strain that's circulating in the area. With that comes, we know that that is extremely contagious, and people really need to take protection at this time.
I want to make sure I'm clear. You're saying you do have test results back which show that Omicron is here?
Yes. So the test, it doesn't actually do a genotype, but it looks at one specific part of the test, and every indication is that most likely we have Omicron that is really the dominant circulating strain.
A couple of big news items breaking today regarding COVID. Number one, from the from Pfizer, word that they're now moving toward the booster for even younger people, 12 and older. Your reaction to that? And I guess I should also ask pointedly, for parents who are still thinking, you know, kids aren't high risks, why do you recommend that children get vaccinated and get boosted?
Yeah, so we're excited to see this recommendation come from FDA hopefully soon. I think CDC is meeting on Wednesday of this week, so we'll get that final approval. You know, honestly, parents really need to talk to their pediatricians about vaccine. If they have any questions, any hesitancy, call Ballad Health. We'll be glad to have those conversations. With Omicron, because it's so contagious, there's going to be an influx of cases. We're going to see new cases probably higher than we've seen. And so that really just means more kids are going to get infected. And so it's really important. We know that Omicron, if not, you know, if you aren't vaccinated, if you aren't boosted, it can still result in severe illness. Even though it may be milder, we're still going to see hospitalizations with Omicron. So the best thing we can do to keep our kids healthy, keep them out of the hospital, to get them vaccinated, and then the ones that have been vaccinated, hopefully in the next week we'll be able to get our kids boosted.
Kids are going back to school. Most schools are absolutely normal, in person, no mask requirements, no mitigation measures being required, it seems. Are you concerned about a surge in cases in schools?
I am. I don't see any way around it. So certainly I encourage parents to have those conversations with their kids. Talk about, is it potentially okay for the kid to wear a mask? Even though there's no mandate, you know, schools still allow that. So really, through this next month, this surge we expect to go up quickly and then hopefully come back down very quickly. So this won't be forever. But I would certainly have those conversations, especially if you have high-risk individuals at home, of what other protection measures besides vaccine their children can take in school.
Other news today from Ballad Health that there has been, I think, a significant number of the cardiac surgical team at Johnson City Medical Center that's tested positive, and out of abundance of caution, you're now transferring those sort of heart bypass cases, those cases that need backup from the surgical team, to Bristol and Kingsport. How should the public read this? You would think that these people are vaccinated, most of them, if not all. What's happening, and how are you all managing that in your system?
You know, if you look nationally, unfortunately, this is one of the problems that we're going to see with Omicron. It is so contagious, you're going to have an overwhelming number of positive cases. There is, as we've shared, Omicron the vaccine is not going to be as effective, so you're going to see breakthroughs, especially if you're vaccinated and not boosted. So certainly a good time to remind people to go get that booster if they haven't. And so, you know, this is what unfortunately we may see more and more in the hospitals. We're certainly seeing it in hospitals nationwide. If you look in New York, if you look in other states, you're starting to see these small outbreaks, because once Omicron comes in, you certainly can spread that very quickly.
Jamie, we also heard last week that there's some medications that's now getting approved to help treat people, prescription-based medications for people who have COVID, that's shown a lot of promise. We heard it's in very short supply so far. Are you seeing the medication make it into our part of the state, and what are you hearing about it? What should people know?
We're very excited to have this medication come to Northeast Tennessee, Southwest Virginia. I do know that in Northeast Tennessee that some of the Walmart pharmacies have received it. So patients need to understand you have to have that prescription from your physician. So if you test positive, if you think you could qualify for this medication, call your physician. There are a lot of drug-to-drug interactions. So you're going to have to talk to your physician. They're going to need to review your medications and determine if it's appropriate for you. If so, they can write that script. As you've probably seen, the drug distribution from the federal government so far has been through those Walmart pharmacies. So it really is talking to your physician and then calling the pharmacies and seeing who might have some.
All right. Jamie Swith with Ballad Health, as always, thanks. And our best to your team members who I know tonight are already exhausted and some of them are dealing with COVID. We appreciate it very much.